And um, thank you so much for joining us on this webinar today. I'd like to introduce our first speaker of the day, who is Dr. Catherine Siengo Mutisia. She's a consultant psychiatrist at Mathare National Teaching and Referral Hospital. She's also on the medical board for Fitness and Further Service. She's also a psychiatrist at Nairobi Parenting Clinic and Nairobi Mental Health Services, and also in the medical advisory subcommittees on mental health, and also under Royal College of Psychiatrists. And also in 2010 and 2014, she was among the ladies that were top 40 under 40 women. So it's my pleasure to introduce Dr. Catherine Siengo to take us through our topic for today, substance use and addictive disorders, where we are focusing on substance, internet, and behavioral disorders. Welcome, Dr.
Thank you. Good evening, everyone. Is it me to share my screen or you're sharing from your side?
No, you can share.
Okay. Please, if you can share on your side, just share.
Okay, give me a minute to put.
Thank you. Diana, you're able to share?
Yes, if you can pull down your presentation, then I'll be able to project my screen.
Is that okay?
Yes, we can see it.
Okay. So do I proceed?
Yes, please.
Okay. Good evening, everyone, and sorry for the delay. So today we are supposed to be discussing substance use disorders, internet, and other behavioral disorders. Many people wonder why we sometimes use the terms interchangeably. Sometimes we would talk of drug abuse, substance abuse, misuse, use. So today's webinar, we hope to understand what is commonly known as addiction, be able to identify risk factors and warning signs, and probably learn some of the ways we can prevent substance use or misuse or abuse, and interventions for those who are already having substance use problems. I know this webinar is for the members of public, but I am also aware that we have many people from the mental space and from medicine, doctors, nurses. And to just clarify that there are two ways of looking at substance use disorders or drug abuse, alcohol and other drugs of abuse. And I will use those terms interchangeably because I know there are people who would refer to them as drug abuse. So when we look at some of our diagnosis criteria, you would see these disorders being referred to as substance use and other addictive disorders. And basically today we'll also be looking at the other subtopic of non-substance, or what we refer to as behavioral addictions. In some settings, they will be grouped under impulse control disorders. And we'll also be discussing why should we take time and discuss substance use disorders. And just to bring all of us on board, addiction can be defined as a state of psychological or and physical dependency on the use of drugs and other substances, alcohol included, or activities or behaviors such as sex, exercise, and gambling. And this is a definition from the American Psychiatric Association. And when we look at some of the new developments when it comes to the diagnosis of, I would say, alcohol and other drugs of abuse or addictions, which could be behavioral or could be substance or could be non-substance, we now know that we are lumping together what we used to call as substance abuse, which is use of drugs or substances outside prescription or not consistent with prescription. So we are lumping abuse and dependency. Dependency is where when one finds that whenever they don't use the substance, they get withdrawal symptoms, and it could be both physical and psychological. So we are now combining the two, and we are calling them addiction and related disorders. And this is basically from DSM-5. And as we discuss further, we'll realize that some of these lumping over the conditions helps with research, and it also helps with clinical management. And we now know that gambling, which is very common in our setup, especially with mobile phones, is now clinically similar to substance-related disorders. When you look at the ICD-11, which cuts across most of many health facilities, including the Ministry of Health, has been using ICD-10. And we now see that as we move to ICD-11, substance use and behavioral non-substance use disorders are now being grouped. The non-substance disorders are being grouped under impulse control disorders, where basically we are referring to repeated failure to resist an impulse, drive, or urge to perform an act that is rewarding to the person. So as much as you want not to take alcohol because it affects it makes you have heartburn, it could make you have ulcers, you still find yourself taking it. And that means that the person is not able to resist. And this also applies to the behavioral addictions, which we'll be discussing. And despite longer term harm, either to the individual or to others, they would repeatedly continue engaging in this use of substances or non-substances. And we've said that things like gambling, compulsive sexual behaviors, and other possible impulse control disorders, ICD-10 chooses to still group them under impulse control disorders. What are some of the emerging discussions? Evidence may indicate that problematic gambling behavior clinically resembles substance addiction in many ways, even when you look at the changes in brain. But also on the same time, data also supports that gambling relationship to other impulse control disorders further supports its categorization as an impulse control. So it can qualify for both lack of impulse control, where you have gambled and lost all your money, you're in debt, and you can't resist it. And on the same time, it will compare with probably somebody using an opioid. And we see now people would get into use of prescription drugs. Probably you have had an injury, you're put on painkillers, and you're introduced to a strong painkiller, opioid or opioid-like. And we see many people constantly using tramadol without knowing better pain that they're actually very addictive. And before you know it, somebody has become hooked to that. We also look at alcohol and other substances. We are seeing a lot of alcohol use, strong drugs, strong concentrations, and we are also seeing a lot of cannabis use, especially in the young people, as they see it being legalized in some countries. That's also one of the emerging problems. Briefly, my colleagues will be talking about other behavioral addictions, just to mention a few like pathological gambling, where somebody cannot also kleptomania, you can't resist stealing, starting fires, compulsive sexual disorders. Some of these things we might brush them, but we've seen in the society. Some people are appearing to be having compulsive sexual disorders. We also have intermittent explosive disorders where people don't seem to be able to manage their emotions. Internet use, compulsive shopping, yes, shopping, and also compulsive leading to things like bulimia. My colleagues from the psychology department will also be discussing that further. And part of the reason why we should be discussing use of substances, disorders, substance use disorders, and non-substance use disorders, addictions per se, is because when you look at the prevalence in our country, because I believe most of the people who have logged in are Kenyans, that we are seeing a lot of alcohol use. And this is from NACADA. It might appear old, but this is what we have as the latest. Prevalence of alcohol use being at 11.8%, almost 12%. Opioids could be less than 0.1%, but very addictive. We know that we now have medically assisted treatment clinics. Mathari has one, MAT clinic, and we have several in the coast, Kisumu, and in Kenya, in Nairobi, we have several. So opioids is a major problem. Cannabis use is also very common, especially among the young people. Prescription drugs, also very common. The young people would call them as matabtab. Nicotine. Nicotine keeps evolving. We move from nicotine pouches, we move from different brands. And we know traditionally there are people who put it under the tongue. It's now coming under the tongue in different nicely packaged packs. Cocaine, very addictive. It might appear like it's very small in Kenya, but very addictive. Pot, there's been a debate about legalization of pot, which is ongoing. Inhalants, we used to see this a lot with the street children, still there. Substance use, people combining different substances. So that is our local setup. But again, the reason why we tend to discuss substance use disorders together with other behavioral addictions is because they tend to occur. So you find that there's a prevalence of people with behavioral addictions will also tend to have other addictions of substances. So like if you look at people who have been diagnosed to have pathological gambling, we see that 5 to 63% of them in their lifetime will have a substance use disorder. Because again, we are saying, yes, gambling is also an addiction, but it's a non-substance addiction. Kleptomania, those who likes setting fires. Some of these things might not be very um, common in some of the setup, but believe you me, as psychiatrists and psychologists and social workers, and in Mathari Hospital, we see some of these things. They might be presenting alongside other disorders. So lifetime estimate of 23 to 50% of substance use. Pathological skin picking, 38%. Compulsive sexual behavior, 64%. Internet addiction, 38%. Compulsive buying, very common with women, is also associated with other use of substances. What are the impact of some of these substances to our health, social consequences, economic burden, education and academic performance, legal challenges, interpersonal relationships, especially with the drug, alcohol, and other drugs of abuse or substance use, as some of us might refer to them. And I think all of us, we are either affected or we say infected or because you find every other homestead as somebody who is struggling with a substance use disorder. And we are also having we also having internet use disorders. It also affects social life and emotional well-being. Risk factors is a combination of both biology, psychology, and social factors. So like we keep saying, even if you're genetically predisposed to have alcohol use disorder, then you need to have been exposed to the alcohol. And some of the social factors would include peers using the substances, family circumstances, family relationships. And sometimes people use substances. Initially, it could be peer pressure. It then moves to feeling good. You're looking for a feel good. Then it moves to uh, now it replaces your production of endorphins and feel good hormones. And as we know, the progression will eventually get you to where you get withdrawal symptoms when you don't use the substances. So you're using it to treat the withdrawal symptoms. Psychological factors, one could start using substances to cope with certain challenges, to cope with not having adequate social skills, to deal with strained family relationships, to deal with self-esteem. Young people saying, when I'm high, I can then be able to socialize, and to deal with mental health problems. We keep saying we can't tell which is the chicken and which is the egg. So if someone is using alcohol, for example, to treat anxiety, and we also have anxiety, alcohol-induced anxiety or depression. Somebody has depression, they start using substances to deal with the depression. And likewise, we also have alcohol-induced depression. So we say alcohol makes your problem look bigger than they are. What about biology? You can clearly see that some patterns point to family history of substance use, and also biology, that genetic vulnerabilities, and also the way you respond to different substances. So you'd find some people will use cannabis and never have any problems. Others will use and develop problems. Likewise, there are people who will use alcohol and not get dependent on it. Others will use it and get dependent on it. So when we look at substance use, or if you want to call it alcohol and other drugs of abuse, uh, there are the biological factors, peer pressure, environment, and also availability. So if you don't access the drugs, then you'll not get dependent on them. If you don't access a substance, you'll not be able to be dependent on it. And that's why we see health workers getting to be, to suffer a lot of prescription drugs um, disorders, uh, substance use disorders related to prescription drugs because of the availability. Again, you see families which even keep alcohol in the fridge. You'll find that the children will grow up thinking there's nothing wrong with alcohol. What about internet addiction? Of course, you have to be able to access the internet and also the online socialization. And it is now being used as a means of escaping from problems. So again, I'll repeat that we will be seeing why substance use and substance dependency have been combined. And we are now talking about substance use disorders could be mild, moderate, and severe. And we have a criteria of how we define whether you are mild, moderate, and severe. The reason why this is helpful is because people who are dependent will begin with using. So you start using, then you move to, when you don't use it, you get withdraw. So it is moving from mild, moderate, and severe. And we can categorize and say, this one is using this substance, this one is addicted to this substance. So that helps us be able to watch as one moves from mild substance use to moderate substance use to severe substance use. Now, DSM-5 recognizes 10 substance-related disorders. Alcohol, very common, legal, and available. So we are now seeing in parties that people are like competing to bring who is bringing the most expensive, most concentrated alcohol, and it's legal. And if you have money, then there's a danger of getting dependent on it. We also have caffeine. Many of us take a lot of caffeine. We also have cannabis becoming a big problem, and especially young people thinking if it's legal in other countries, then it's also legal in our, then it must be not harmful. And we are seeing a lot of young people, their motivation getting affected, motivation to work, to study, to socialize. Um, and again, we know that yes, some people will get away, they use cannabis and have no problems, but others will get problems. Some will even get cannabis-induced psychosis, hallucinations. Several of them, we get globalized. We have so many of them. Inhalants, we've seen it in our streets. Opioids, um, we are now having both the prescription and the non-prescription, the synthetic and non-synthetic, naturally occurring. Sedatives, starting with what is commonly accessible in hospitals. Um, and we know that even as PPB regulates sale of drugs, DDA drugs, they are still getting out and being used. Hypnotics for sleeping and anxiolytics, stimulants, including amphetamine substances. And we are consistently seeing people, of course, some have undiagnosed ADHD, that is lack of attention, hyperactivity, or either just purely lack of attention or purely hyperactivity. We are also seeing people coming to our offices and saying, I think I have ADHD. We know that in some cultures, students, university students sitting exams will tend to abuse some of the stimulants like methylphenidate, which is used for treatment. But we know that someone who has diagnosed ADHD will benefit from the treatment. And we also know that many people who are using substances have untreated ADHD. That is a lack of attention and hyperactivity, either of the two, or some people suffer from the combined form. Tobacco, very common. We are now debating, is it vaping? Is it putting under the tongue? Is it smoking? They all are. Today we are discussing addictions. Tobacco is very addictive. And we have also said caffeine is addictive. Let me not use very. We have said cocaine is also very addictive. It's a stimulant. Amphetamine-like. Some people will wonder what is wrong with cat. It is amphetamine-like. So basically, what I would want is to just give an overview and let people ask questions. I believe even as the psychologists in the panel and the social workers in the panel, as we discuss further, we will be generating questions, because I've seen when we logged in, we were over 400 people. So I'm expecting that this discussion is generating questions, and it makes sense to answer the questions rather than lecture. Now, we know that from a medical point of view, from a doctor's point of view, when you use a substance, you're not just dealing with the substance. There are other problems which need to be treated. So like some of the problems could be as severe as psychotic disorders, bipolar disorders, depressive disorders, anxiety disorders, obsessive compulsive disorders, sleep disorders, sexual dysfunctions, delirium, neurocognitive disorders, withdrawal, and the problems coming as a result of withdrawing from the substance. So when you're using a substance, let's say alcohol, which is commonly available, it could cause either of all these symptoms. It could cause commonly alcohol-induced depression, and that's why we see even people who self-harm or commit suicide, they're intoxicated. And we keep telling our patients, you know, alcohol makes you think your problems are bigger than they are. So as medics, we will and therapists will also be looking at what else can these substances cause. And the 10 categories: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, tobacco, and others. Commonly, those are some of the common names used locally. I won't read them. You can see what some of the names used. Some might be old. This is not, I am sure there are more names coming up. What people locally would, especially the young people, have crafted names for alcohol, nicotine, cannabis, cocaine, hallucinogens, inhalants, opioids. So I don't need to read through because different setups will use different names. Um, Penicillin, stimulants, sedatives, hypnotics. Um, so different parts of the country, different areas of the region will use different names. Now, when it comes to treatment intervention, we know that there are cases where we advise, if you are looking at, let's say, alcohol withdrawal, that it is safer to even take that alcohol before you reach a hospital, because withdrawal can be very severe, can cause conversions, can cause very severe physical symptoms. So that's why we talk of detoxification or stabilization. You stabilize the patient first. We can't do away with therapy because we know people get to substances, or if you want to call them alcohol and other drugs of abuse, because some are either dealing with trying to self-medicate issues they have not dealt with, or they lack social skills, or they just have dysfunctional family relationships, or genetically predisposed, the environment, peer pressure. So there are so many things, and that's why therapy is very key, support groups, and that's why we have AA meetings where people remind each other that, yes, you have a problem of alcohol use disorder. And we say that once you've had alcohol use disorder or any other addiction, then you can't say today, I'll just do social drinking. It's like your mind remembers where you used to take it. So you start with one drink, and before you know it, you're drinking every day, every hour. And when you don't drink, you get withdrawal. So support groups are very key. Medication, we are now moving towards medically assisted treatment. And that's why we have methadone clinics. Madari is the oldest methadone clinic in the country. MAT Clinic, popularly known as MAT Clinic, doing very well. And so when you're dealing with substance use, we have to look at the holistic approach. We have to look at psychotherapy. Sometimes we use medication for withdrawal symptoms, but we also use medication for long-term treatment. We also have behavioral therapies, with building coping skills, providing positive reinforcement. Sometimes we need hospitalization to detoxify and begin the long-term treatment. And one of the benefits of inpatient treatment is that you are sure that this person is not accessing the substance. But believe you me, we've seen people package alcohol in juice packets. We've seen them hide it in all manner of things. So it doesn't mean that unsupervised inpatient will guarantee that the person is not able to access the substance. So even hospitals and inpatient facilities have to consistently supervise and make sure that the goal of making sure that the patient is not accessing, or the client is not accessing the substances. You don't get people finding shortcuts to undo what you're trying to do. Support groups, provide peer support, resources, and accountability. And so treatment and rehabilitation, we know there are many people who will quickly uh, take their loved one to a rehabilitation center. And what we need to know that people use substances. Let's say, for example, alcohol. We know that alcohol affects all the systems of your body. We know that liver function will be affected. It could affect your digestive system. That's why you get people getting ulcers, gastritis, heartburns. It can affect your brain. You see people getting memory losses. It can affect your nerves. It can affect your skin. It can affect absorption of your vitamins. So some people will say, I eat very well before I drink. But we know that as you take a lot of alcohol, it corrodes the alimentary canal or the digestive system, because I know this webinar is also for members of public. And so you find, yes, you're eating well, but uh, your digestive system is not able to absorb the vitamins. And that's why then when part of detoxification for alcohol, we will need to use intravenous vitamins, specifically B complex, because then if they're not getting absorbed, then they're not going to the brain. So that means that, yes, you could be eating well, but the vitamins are not being absorbed, and you will lack vitamin B complex and all the vitamins in your brain, then we can have all sorts of problems. So treatment and rehabilitation varies according to the substance we are referring to or we are discussing. It varies according to the patterns of use. There are people who would disappear when it's month end or when it's Friday. Binge drinking is equally harmful. There are people who say, but I don't drink every day. Actually, it might even be safer to have a small drink every day than to binge drink over the weekend. But when we say moderate drinking, what are we talking about? There is no safe alcohol or substance use. But we say if you must use, what is then moderate drinking, which we are not seeing in our setup. A drink is like one pot, one standard glass of wine, or one beer. And the reason why I'm giving examples is I know there are people who would still use the substances anyway. And even if you insist on total abstinence, there are people who will still use. And so when you talk of one drink, the patterns we are seeing in Kenya is that uh, somebody on a Friday will take a whole 750 or 40% alcohol. That is binge drinking, very harmful. It can even kill. So it depends on the patterns of use, the psychosocial support you have, and the individual features. Um, Treatment could involve abstinence from substances. It will also involve physical, and that's why we say that even as you aim at psychotherapies and rehabilitation long term, the body, the physical, you can never separate the body into the physical, the social, um, and psychological. So you have to treat the physical, the complications of, like we know that use of opioids, the injectable ones. And the reason why even some countries go ahead and give you free needles to exchange, some key countries even go to the extent of giving you the heroin to inject and the needles, is because they know that use of shared needles could predispose to more severe physical problems like HIV, hepatitis, which are very expensive to treat. And harm reduction comes in, and you wonder, why would then a hospital be providing these things? Why would a hospital be providing medically assisted treatment like methadone clinics? It's because when you look at the use of injections, one, these are illegal substances which people will spend a lot of time looking for them. They are very expensive because they are illegal. They are sharing needles. They are getting many other problems. And it wears off in 4 hours, as opposed to methadone, which you'll take once a day. It's controlled. And again, some of these substances are very severe with withdrawal. So when you have medically assisted treatment, then you are able to function, take your medication, go to work, function throughout the day. You don't have to sell your property to buy some of these drugs. So some people have questioned what is MAT, or medically assisted treatment. It's scientific. So I'm looking at the physical. Why do we go to some of these lengths? It's because of the physical problems, the physical body, that you can get severe problems with the physiology and with the physical body, psychiatric complications, psychological complications, and the general well-being. Inpatient versus outpatient. Treatment can be inpatient versus outpatient. The only problem with outpatient is we are not guaranteed that you will not continue accessing the substance we are trying to wean you from. Detoxification, sustained period of rehabilitation, individual, family, and group therapies, education about substance use, and psychosocial support. My approach would be that we get more of questions and discussions. Let me also say on behalf of the Mathari Hospital fraternity that one of our speakers got an accident last evening, Jacqueline, our social worker, but we have a big team. So we wish Jacqueline quick recovery. We have a big team. I will stop sharing my slides so that I can allow my colleagues to quickly educate us on the non-substance addiction. And then we can spend more time answering questions and looking at the charts. Thank you very much. Diana.
Thank you so much, Dr. Siengo, for that insightful presentation. Right from the emojis, you can see the claps, the hearts. Thank you so much for sharing your knowledge with us. We have learned quite a lot. I would like to invite Ivy to put up the second part of the presentation on behavioral disorders, and then we can proceed from there. Thank you so much as well for the questions. We can see the questions coming in. We will take these questions shortly after we are done with the behavioral disorders. Welcome, Ivy.
Hello, good evening. Thank you so much, Dr. Siengo. Your presentation was quite informative. So I am going to be assisted by Diana to cover the segment that Jackie Araya was going to cover for us. Get well soon and have a speedy recovery, Jackie. We're going to talk about internet addiction, and Diana is going to cover the behavioral disorders. Internet addiction is a behavioral addiction characterized by excessive or poorly controlled preoccupation, urges, or behaviors regarding the internet. So these are the kind of people who are unable to stay offline. They cannot unplug. A certain person whose phone, when they go off, they get nervous. They can even have a panic attack to try and find a charger. With internet-related disorders, we're going to talk about gaming, social media addiction, that is the people for TikTok, Facebook. You're like scrolling on your phone for hours and hours. You find that people do not sleep at night, or somebody wakes up early and the first thing that they reach out for is their phone so that they can check their social media. We're going to talk about internet gambling, people for Aviator and SportPesa and all those platforms that we usually talk about. I see a lot of people are amused by this. There's also pornography consumption. So with internet-related disorders, we're going to talk about gaming. So gaming is defined as a pattern of persistent or recurrent gaming behaviors over other life interests. So you find that your children do not go out to play nowadays. They stay on the internet, on their console, just playing games, and they communicate with strangers out there. They have friends there on the online. They will never leave their house. They just continue playing. So where the symptoms for this is the person has preoccupation with the games. It's all they talk about. They have withdrawal symptoms when they're not gaming. That is, for example, you take your child to church or to a social gathering, but the whole time they just want to go back home. They just want to go back home. And then there is tolerance. Just like in substance use, you find that the person wants to be there more, to play more. They want to get to the next level of the game. And they have unsuccessful attempts to control the gaming. So even when you take away the console, this person will go out of their way to disobey just to continue having the gaming. And then there is social media. It's also characterized by the excessive need of social media platforms, leading to impairment in their own personal, social, or occupational functioning. So you find that somebody is at work, but they're just on their phone. You find that the internet is running slow because people are on social media, or you find that people are trying to have a family gathering, but everyone is on their phone. There's also constant checking for the signs that the person is constantly checking for social media. We find a notification, everything stops, they have to check on their phone. You find that they neglect their real life relationships. They do not talk to people in their house. They just come in and they go on their phone, or they come to work and they find their corner and they go on social media. There's also online gambling. That is the people for that I mentioned earlier who go on SportPesa, on Aviator, all these websites that we see nowadays. It involves engaging in online gambling activities to a degree that it disrupts your daily lives. So at the beginning, it's all fun and games, but it gets to a point where the person is just really preoccupied with gambling. When it reaches a certain time of the day where there's football, the person is completely disconnected. They need gambling with increasing amounts of money. So you find that somebody, maybe this day they put 10 shillings on that bet, then the next time they win something, it's like reinforces them. They come and even use money for school fees that was allocated for other things to just continue gambling, regardless of the losses that they get. Then there is pornography addiction. That is the compulsive use of sexually explicit material, videos, images, streaming, or even written material, leading to significant impairment. So you find that their relationships suffer, and there's reduced intimacy, there's communication problems. Somebody cannot look you in the eye anymore. There's unrealistic expectations in their relationship. And then they also have difficulty establishing sexual relationships. You might find that they have these preconceived expectations that they see in the pornographic material, and now they want to come and expect the same from their partners. The symptom for this is preoccupation with pornography. You look at the history, every time they are online, that is the first thing they go to. They're unable to reduce it, they're unable to stop. When you stop them, they can get anxiety or they can get depressed. And the people usually neglect their own personal, social, or occupational responsibilities. So the diagnostic criteria for the internet addictive behaviors, they are preoccupation, like we talked about, the way somebody would just talk about gaming, gambling, or the pornography. They're just preoccupied by the particular activity and anticipating the next online session. So they just cannot sit still in a meeting. They just want it to be over so that they can check WhatsApp, so that they can check TikTok. You can even hear sometimes people by mistake, they can turn on their phone. You hear they're watching TikTok, just scrolling over and over different sounds. And then there's withdrawal symptoms. That is, a person experiences restlessness or irritability or anxiety when they're unable to access the internet. So you find somebody just moving around the house trying to find where the network is strong. We find people in areas where there is internet access in the office. They are all gathered there in that kind of place. Tolerance. So there is needing to spend an increased amount of time or money online to achieve that satisfaction. So it's like a drug. They just need to get a fix. And once they get some, they need more. Every time it keeps increasing. And then there is an unsuccessful attempt to control. So you might find a person wants to stop gambling, but they just keep finding themselves over and over again, continuing with the same. Then there's loss of interest. They neglect other hobbies, so they cannot go outside and socialize with people. They cannot do anything that does not include their phone. Continued use despite problems. So you might find that using the internet, despite knowing its adverse effects on relationships, work, or health. So somebody can gamble out their whole rent, their whole school fees, but still, even after going through that, they would do it over and over again. So there's deception. So people will start lying to family members, to friends, to conceal the extent of involvement with the internet. So even just a simple question of, uko kwa simu, are you on your phone? It will really trigger them and cause anxiety because there's that aspect of shame that comes with it. So they will lie. There's also escape. So people using the internet to escape from negative moods or real life problems. So for example, somebody might come home, maybe there is conflict in their house, but they will just go straight to their phone and not talk to anyone. And then there is risk of losing opportunities. So people jeopardize or lose significant relationships, jobs, or education opportunities due to this addictive behavior. So signs of these addictive behaviors is there are behavioral ones, there's emotional ones, and there's physical. So for behavioral, there is excessive time spent online. You can just see that behavior. There is neglect of duties or disrupted sleep. So you find that somebody might be online the whole night and they know well that they have to be up very early in the morning. So even when they sleep past midnight, they wake up early and the first thing they reach for is their phone to continue going on the internet. Even when they're at work, they cannot concentrate fully because they want to check their messages. They want to check who has posted, what blog has posted, what gossip. They always want to be on the internet and they feel like very uncomfortable not being there. So let's talk about the impact. And I will just touch on this because Dr. had already spoken on it. So the impact of internet addiction would be your mental health. So you find that these people have increased risk of anxiety because they do not socialize in person with people. So when they find themselves in an actual physical social setting, they are unable to cope. They feel uncomfortable. They might feel depressed when they are not able to access the internet, or maybe because of the consequences of the negative consequences of the addictive problem. There's stress-related disorders that can come from it. Physically, we talked about sleep disturbances, the posture. You find that people nowadays are bending before they're even 50. There's eye strain, and then there can be carpal tunnel syndrome where the finger can have some some nerve issue. There's social life when a person neglects their relationships, they isolate themselves socially, and the decreased participation in offline activities. So the risk factors that predispose people to internet addiction, we'll talk about personal factors. So some people have pre-existing mental health conditions like anxiety, so they find it easier to socialize online, which predisposes them to have an addiction. There is also low self-esteem and lack of social skills. Then there's environmental factors. So there's easy access to internet. You find that people in areas where there is easy catchment to internet are more susceptible to be addicts than people in other areas. Then there's lack of parental supervision. You find that most parents these days, when they give their children tablets and phones just to occupy them to avoid dealing with a tantrum or homework or something. So they do not want to supervise them, so they just put a device in front of them. So there's also high expectations from school or work, might make you end up being on your laptop because you needed to do some job. There is also behavioral traits, that is impulsivity. So you find someone is putting a large amount of money to gamble. These sensation-seeking behaviors, they just want to feel that excitement of winning a bet, so they will just continue seeking for it. And there's never a top of that mountain. It's always trying to reach the top. And then there's presence of online or offline interaction. So for preventive strategies for internet addiction, we'll talk about education and awareness. Like Mathare Hospital has been working on mental health awareness months with all these webinars. It's important that people are aware and that we inform people of the risks and signs of internet addiction so that you can be mindful and get help. There's healthy habits. You can encourage balanced use of the internet or regular physical activities or offline hobbies. There is also parental guidance, especially for children, to limit their internet use. You can use settings to restrict some pages that children should not access. And you can also foster open communication about online activities with your children so that you can know what sites are those you're visiting, who are those friends you're having online, what pages do you have. It's important to also have that kind of contact. There is also the support systems, developing strong support networks, including family, friends, and the mental health professionals so that they can assist you to be able to overcome this addiction. Thank you so much. I think I shall hand over to Diana Walegwa to finish with the behavioral addictions.
Thank you, Ivy, for that wonderful presentation. In the interest of time, I want us to briefly look at other behavioral disorders, and I think you have covered parts of them, but we picked out things that we generally see in our clinical setting and also in our day-to-day lives. These are things that probably you could look at and see if you've seen it in someone else. So when we're looking at behavioral disorders or behavioral addiction, these are basically non-substance related disorders, and they involve a compulsion to engage in a rewarding and substance related behavior. That's why we are seeing things like gambling, shopping, excessive exercise, work addiction. And also you see that despite any negative consequences that the person is getting or the person gets, they still continue. So there are consequences in terms of physical, mental, social, and financial well-being. But despite all these negative consequences that a person is experiencing, they would still continue with the use of the substance or the behavior. So when we look at gambling disorder, gambling basically means that someone is willing to risk something of value in the hope of getting something of even greater value. That's how you would see people would place a bet and say, this is rent, I'm hoping to get much more that will give more reward. So it's always that I'm placing something that, yes, I value, but I'm hoping to get something of greater value. And gambling can stimulate the brain's reward system, much like what alcohol and drugs do. And this often leads to an addiction. And these individuals who gamble, they'll continually chase bets that lead to losses, using up savings and creating debt. And so when we look at gambling disorder, it's persistent and recurrent problematic gambling behavior that leads to clinically significant impairment or distress. So there's an element as well of dysfunctionality that is going to be created in this person. What are some of the symptoms that we see? Preoccupation with gambling. So every time they're on their phone trying to see which bet should I place, where can I get the maximum benefit, where should I place my money? And also there's needing to gamble with increasing amounts of money. So you'd see that they would bet this time 100 bob, the next time they will increase, hoping that their chances of actually getting more money would increase. And also there's repeated and successful efforts to control gambling. And also just chasing losses, where they really try, they'll say, today is my last day, after probably getting a bad loss or not getting any wins. They'll say, today's my last time to gamble, but you would see they'll still go back to that same behavior. When you look at shopping addiction, which I want to also look at compulsive spending, this is just pathological buying, is when a person feels an uncontrollable need to shop and spend either for themselves or others. It's compulsively buying things that a person does not necessarily need, or they're not even affordable to them at that particular time. And compulsive shopping is characterized by symptoms such as they would excessively shop, and their thoughts are constantly around, what time can I shop? Where is the next best buy? Remember, I've talked about it's things that someone does not necessarily need. And such thoughts and behaviors generate considerable distress and impairment, and it can also seriously affect the person's financial well-being and also social relationships. So some of the symptoms that we see, they are always preoccupied with shopping. These are people who know the best buys. They would know where is a place that I can get things on credit, and then with the hope that I'm going to pay at the end of the month or at the end of the week, or when they are expecting to get money, or buying items that they don't need, or even they are not able to afford. And also there's a feeling of euphoria. They feel very good while shopping, but also after, there's a lot of guilt and shame, because they are thinking, this is something that I want to break. I don't even need this thing. Why am I constantly buying? And so there's a lot of guilt and shame that comes with that. And you'd find they'll constantly seek to hide this behavior from their loved ones or people around them, such that by the time people around them are noticing, sometimes the problem is so big or too far gone. Exercise addiction is compulsive engagement in physical exercise to the point where it negatively impacts their physical health, emotional well-being, or social life. And so you'd find they are unwilling to take any rest days. So it's every day, regardless of how they are feeling, they will still exercise. They exercise through injury, and they prioritize exercise over other aspects of their life. And also when you look at work addiction, an uncontrollable need to work insistently, often at the expense of personal health and relationships. And some of the things that we would see with these people is they work extremely long hours, they neglect family and social life. They feel restless when they're not working. It feels like there's something wrong. I should be doing something. Even spending time with family, it's like, quote unquote, I'm wasting time, so I need to be back there. And using work to escape from personal problems. So sometimes some people would use it as just a coping mechanism. So you'd find that they're excessively spending time at work as opposed to dealing with the things that, or problems or stressors that are actually going on in their lives. Next slide. Yeah. And what is the diagnostic criteria of the DSM-5 considerations? We'd see that there's preoccupation, constantly thinking about the addictive behavior or planning the next session. So I've gotten money for this, fine. I did not get a win this time. What can I do better the next time? Who can I be able to probably follow on social media who never loses a bet? So everything now around their lives revolves around, how they are going to fund their addictive behavior, what time they're going to spend on this addictive behavior. There's an element of tolerance, which is basically needing to engage in the behavior more frequently or more intensely to achieve the desired effect. There's also an element of withdrawal, which Ivy talked about, feeling restless, being irritable or anxious when unable to engage in the behavior. There's an element of loss of control, sorry. So there's unsuccessful attempts to cut down or stop the behavior. They will tell you, I've really tried, but I'm not able to. And you would hear them constantly say, this is my last attempt. And then they go back to the same behavior. And sometimes it creates as well for them a sense of a lot of helplessness, because they are thinking, I have tried so many times, but I'm not able to. I still keep going back to this same behavior, even though I have told my family, even though I have promised myself that this is not something that I will get back to. They also neglect other activities in their lives, giving up or reducing participation in important social, occupational, or recreational activities. They would drop any hobbies that they had. They would drop any time they would spend with family or friends, and now basically focusing on this behavior or this addictive behavior. You'd find even they would neglect their personal hygiene. They wake up in the morning, the first thing that they do is they're pretty much, you've talked about preoccupation, so they're preoccupied with this particular behavior. There's continued behavior despite the problem. So there's persistent behavioral problems, and you would pick out it's causing dysfunctionality in their lives. But despite those problems, this person still continues with the same behavior. Despite them losing probably friends, losing work, they'll still continue with that behavior. On the outside, it looks like, why is this person not getting? But from the inside, there's that element of loss of control. And when we look at the comparison between substance use disorders and behavioral addictions, there are similarities that we see. They both involve compulsive behavior patterns, and both can lead to significant impairment or distress. And both the people exhibit tolerance. There's an aspect of withdrawal, and there's also an aspect of loss of control. And in both, they can disrupt personal, social, and occupational functioning. Basically, it causes dysfunctionality around this person's life. When you look at the impact, I think the impact is still the same as we talked about when you're looking at behavioral, their mental health. So there's increased anxiety, depression, stress, decreased self-esteem, and overall life satisfaction. There's also an impact in their physical health. Either they have neglected their physical health, or for example, the people who have exercise addiction, you would find that also their physical health has been affected. And also you'd find, like with shopping addiction, there's an element of them just constantly going out to shop. And because of that, sometimes we're looking at issues of obesity, because most of the time they're just sometimes seated just ordering things online, so they're not doing anything around taking care of themselves. There's also chronic stress that we are looking at. There's also an impact in their social life. Remember, we have talked about the neglect things that they used to do before. So they would meet up with friends. They had a budding social life, but now they are isolated, just basically concentrating on their addiction. There's also financial and legal consequences. Ivy, I lost the presentation, but that's okay. So there's also legal consequences. So for example, you'd find a person who has a lot of debt because they probably put a lot of money or their rent into betting, and so now they don't have school fees, they don't have rent, and that causes a lot of financial issues. So they're constantly in debt, asking people for finances, asking people to chip in. Maybe they bet, they put a bet on all their rent, on all their school fees, and now they're not able to manage their day-to-day lives. Preventive strategies, the first thing that always look at is, yes, preventive. Public awareness, basically people to know that, yes, these addictions are present, these things happen, but also there is a way out. It's not the end of the road, that there is help. Also creating supportive environments, support can come from family, can come from friends, just someone having a supportive environment that they're able to heal from these disorders or be able to detach from some of these behaviors that they've had. And also healthy lifestyle promotion, which include encouraging balanced lifestyles, including regular exercise, healthy eating, having adequate sleep, having a social life apart from work, maintaining a healthy work-life balance. And now we are able to see an individual coming up and leading a healthier life. So that is the end of behavioral addictions. And thank you for the questions. I think very fast would like to go through the questions that ourselves and also Dr. Siengo would answer. Doc, there's someone who's asking, how does one manage someone with nicotine addiction? They're asking for a stepwise management depending on severity. Oh, sorry, is stepwise management depending on severity?
Thank you very much. I think to respond to that question, one is to reduce the number used per day, the number of either sticks or pouches or whatever it is. There are different types of nicotine these days. There is the nicotine replacement, which is tapered down. The same way we do detox for alcohol with benzodiazepines, we would also have tapered down nicotine, comes as patches, which you can have a 24-hour patch, or gums, which are taken when necessary. So you go reducing them. And with time, you also look at the motivation. Why do you want to quit smoking? Because with most of these behaviors, you have to really be motivated to quit. So combination of detox and substitutes, tapered down with the motivational interviewing therapy, peer support, will eventually lead one who has decided to quit smoking, quit. Yes.
Thank you very much for that. Let me combine two questions. What is the active ingredient in cat that is very rare? Is it addictive? And is it classified as a substance abuse in Kenya? And also, still on that same question of cat, there's someone who asked, is mental health and psychiatry department at the Ministry of Health involved in advising the government on the effects of cat on population, since it's categorized as a cash crop and non-harmful, hence its availability?
Is that for me, Diana?
Yes, Doc.
Yes. So we gave you 10 classes of the various substances. Yet cat is a substance. It's a stimulant and it's addictive, because today we are discussing addictions, and it's one of the substances people can get addicted to. Whether the Ministry of Health is involved, yes, there is a Department of Mental Health, and we have our new Director of Mental Health, Dr. Mercy Karanja, who is spearheading that. But I also want to tell members of public that Mathare Hospital 1 as the preventive arm, that is what we are doing today, health talks. We've had webinars the whole of this month, but the treatment and rehabilitation, I'm in charge of one of the wards, rehabilitation wards, male and female. We also have a clinic which runs every week, a substance abuse clinic, a treatment clinic. We also have a MAT clinic, methadone clinic, or MAT clinic, depending on, because I know we are talking also to the members of public. So yes, the ministry is involved. There is the National Substance Use Management Protocol, which we launched several years ago. We have the mental health policy, which also talks about substances. And the role of the Ministry of Health being policy, there is also the counties, which have a big role. And most of the time, we need to educate people to stop looking at substance use disorders as sorry, I think I've said enough.
Thank you for the response, Doc. Lastly, before I invite Ivy to answer some questions, there's someone who's asking, are there cases of pediatric addictions from opioid-based cough syrups, and what is the treatment?
Yes, opioids, codeine, very popular among school kids. Not to say that those who have not tried should try, but it's commonly used. I know PPB is doing their best to control use of those substances, but now you find somebody buying codeine from one chemist, moves to another one, moves to another one. So it is a big problem, even in schools. Codeine is controlled. Even tramadol, betapine are controlled, but we are still seeing them being abused.
Thank you so
Diana?
much, Doc. Thank you for the responses. I think there's someone, Ivy, I don't know if you were there to answer, how does one gauge that someone has an internet addiction, especially with the current generation?
Okay. Thank you, Diana. Can you hear me?
Yes.
Okay. So identifying internet addiction, especially in today's digital age, it involves the same criteria that we had shared earlier. There's going to be excessive time being spent online. There's going to be withdrawal, showing signs of irritability or restlessness or anxiety when one is unable to access the internet. There's going to be neglecting responsibilities, that is failing to fulfill obligations either at work, school, or at home due to the excessive internet use. There's going to be preoccupation with the internet. So the person will constantly be thinking about being online or even engaging in other activities as well. So there is lots of interest in activities that are offline that they used to enjoy before. There's going to be social isolation. That is when a person is withdrawing from real life social interactions and preferring online communication or their virtual friends. There's also the impact on their physical or mental health when a person may experience depression, anxiety, or sleep disturbance issues related to this excessive screen time. I'd also like to address the question that somebody asked, is masturbation a sexual disorder? So masturbation itself is a common sexual behavior that many people do engage in. And it becomes a sexual disorder when it interferes with daily functioning, causing distress or leads to negative consequences, because that's how we define addiction. There has to be interference with daily function. It has to cause distress and lead to negative consequences. One final question I'd like to answer is about the slides. Kindly share your emails to on the platform if you would like to be shared for the slides. Diana.
Yes.
Oh, can you hear me?
Yes, I can.
Okay. Let me tackle one last question. It's from a person called Lillian. She is asking, which are the alternative coping skills for anxiety or the ADHD in place of excessive internet usage? So, Lillian, there are several alternative coping skills that can be effective for managing anxiety or ADHD without having to rely on excessive internet use. So one of the techniques you can use is mindfulness and relaxation techniques. That is, practice mindfulness, deep breathings, activities. There is, you can find meditation, guided meditation videos. There is physical activities. You can do a short walk, you can do yoga or jogging, or you can even just dance to release pent up energy and to be able to just improve your mood and reduce anxiety symptoms. There's also healthy lifestyle habits like maintaining a balanced diet and prioritizing having a regular sleep pattern. You can also do time management and organization, use a calendar to plan your things so that you can be able to reduce that overwhelming feeling of having to plan and have the less decision fatigue that can cause anxiety. You can seek support from friends, create other outlets like painting, writing, music, gardening, or you can see a professional psychotherapist and they can take you through what we call CBT, which can help you to be able to cope better. I think that is it for me. Diana, over to you.
All right. Thank you. Thank you, Ivy. Doc, if you could answer these two questions, what is the current management of an alcoholic patient? Is it compulsory to detox all alcoholic patients? And secondly, there was someone who was asking about dual diagnosis. How should treatment programs be designed to effectively address co-occurring disorders where patients suffer from both a mental health issue and a substance use disorder?
Yes, so alcohol use disorder can be classified as mild, moderate, and severe. So when you're dealing with severe, even moderate alcohol use disorder, then you have to deal with the withdrawal symptoms. So the withdrawal symptoms would involve tremors, anxiety, convulsions. So they are so severe that you have to deal with them, and that is what we commonly refer to as detoxification. The other question is on what, Diana?
Management of dual diagnosis.
Now, dual diagnosis, I said that it's very difficult to know which is the chicken and the egg. So like, for example, alcohol, which is commonly used. Some people will start using alcohol to deal with anxieties or depression. Other people will then develop alcohol use disorder, alcohol use depression, induced depression. And so it will be a co-occurring disorder. So once you do the detoxification, you stabilize the patient, then you're able to pick any other mental disorder because you could also be having another mental illness like ADHD, very common. People with untreated ADHD will constantly look for things to stimulate themselves. So including substance use, hyperactivity. So once we pick the ADHD and treat it, then the person will not be looking for alcohol to deal with the lack of attention or hyperactivity. Yes, there are various co-occurring disorders. One of the slides had all the various co-occurring disorders. Yes.
Okay. Thank you. Thank you so much, Doc.
And
I want to...
sorry, Diana, to
Yes,
also
yes.
mention that one, you could have alcohol, develop depression, hypertension, diabetes, the physical problems as well. So we should not forget that alcohol will induce gastritis, ulcers, likewise hypertension, obesity, because these are empty calories. So you're taking alcohol, you don't get full, you still have to take food, yet the alcohol is calories, they're empty calories. So obesity, diabetes, hypertension, heart diseases, actually alcohol affects all the systems of the body. Sorry.
Thank you. Thank you, Doc. I just want to read a comment from someone who says, gambling gets serious, may sound hilarious, but people have lost trust in their spouses because of a lying habit to get money to continue gambling. School fees fly away in Aviator, also rent money. Very, very true. That people have lost property, people have lost relationships because of this, because of gambling and other behavioral disorders. And maybe, Doc, maybe you can answer this. What are the most successful strategies for preventing relapse in individuals recovering from addiction? And how can these strategies be personalized to meet individual needs?
So we are now moving towards more individualized treatment because everybody, one, has different psychosocial circumstances, different predisposing factors. So, but the overall is to stabilize the person medically, physically, psychologically. Sometimes it might be medically assisted treatment or detoxification. So it is individualized. But the reason why many people are used to the 90 days rehabilitation is because in 90 days, one, you'll have learned how to live without the substance. And three, that even as I sit at the board for assessment for fitness, we know that you're away from work 3 months, then you start getting half a salary. The next 6 months, you should be assessed for fitness. So the 3 months also, one, your body learns to live without the substance. You have peer support. You have group sessions. You have individualized sessions every day. You cannot access the substance. And at the same time, then you can easily go back to work without going to have a salary as you look at the labor laws. Thank you.
Thank you. Thank you, Doc. There's a question. I want to combine two questions that someone has been asked. Some addictions to alcohol makes people sell items just to get it. At this point, are they likely to get help? Yes, there's always help. When you look at the stages of change before even someone gets to admit that they have a problem, other people sometimes are the first ones to pick out that, okay, this person has a problem. Unfortunately, sometimes with addictions, the person who is suffering is often the last person to know or to see it. Remember, we talked about as well an element of a lot of shame and guilt. And so for some people, it becomes very hard to even admit that, yes, I do have a problem. Yes, I cannot manage my alcohol. I cannot drink just one glass, as I have said. And so for some people, it takes a while for them to admit that I have a problem and I need help, and this is the help that I want to get. And so therapy really helps to be able to help this person move through the stages of change from I don't think I have a problem to yes, I do have a problem, but yes, they are likely to get help and there's always help. So most of the questions I think have been answered. I'm seeing people have dropped their emails to be able to get the presentation. Someone was asking, where is the normal use, where is the normal use, and where do we classify as abuse? I think when we've looked through the different stages, as Ivy has explained, how to simply think about it. If it causes dysfunctionality, then we start looking at it. Okay, this is a problem that needs to be addressed. This is a problem that you need help with, right? There's someone who's also asked a question about the element of cross addiction. Is it happening that the help you're using as a strategy for an addiction becomes an addiction itself? You suggest physical exercise for an internet addicted person, and eventually the person becomes addicted to physical exercise. Yes, sometimes there's an element of cross addiction where someone is addicted to another substance. But I do agree with you, physical exercise is very good and it really helps. Also, it's in line with this month's theme for the Mental Health Awareness Month of Movement for Mental Health. But anytime you'd find that there's an excess of what you're doing, if it's causing you dysfunctionality, then that's a place for you to seek help, right? Yeah. I don't know if you can help with this question as we close. I'm seeing we have a minute to close. Someone is asking, in terms of pornography addiction, how will someone ever know that this is happening unless it is diagnosed in the hospital? It can be so hidden and can be very hard to know, especially if it is an older child or adult.
Hello. No, so
Yes,
with
yes,
that,
I can hear you.
I'm going to use the same criteria that we talked about earlier, that it does not, it will cause impairment in other areas of life. You shall see that a person may be struggling to communicate with others. the person may isolate themselves. They may withdraw from any offline social setting, and you can always tell from the impairment in other sections of their lives. I think that has been covered completely, Diana.
Yes, thank you very much. Okay. I think we have answered most of the questions. Still continue to get this information, and also probably still continue these webinars to be able to tackle some of the questions that have been asked. But because of the interest of time, and would really like to honor the time that you have given us, would like to end there. And again, just wishing Jackie quick recovery. I'd like to invite Nelson to end the webinar. But before I do, I really want to thank each and every one of you for taking time off your busy schedule to just join us in this webinar. And we really hope that you have learned a thing or two, and also you will disseminate this information to other people.
Thank you, Ivy, Dr. Catherine, Jacqueline in absentia, and Diana Walego for the wonderful presentation. It has been a fruitful engagement. As announced, or as you can see on the screen, this is part of our Mental Health Awareness Month. May is Mental Health Awareness Month, and we have been having this series in partnership with the Madari Hospital. Please look at Ivy. When is the next session? Will it be on Thursday?
It will be on Thursday at 7 to 8:30.
Come again?
It will be on Thursday from 7 p.m. to 8:30 p.m.
All right. So as you've heard, our next session will be on Thursday, 7 to 8:30 p.m. Kindly join us as we look to be winding up on the Mental Health Awareness Month. Also, the questions that you have posted, or any other question that you might have post this session, you can also send them during that session. The able panel from Madari will be able to assist you. Thank you once again for joining us. Do have a wonderful evening.
Thank you and good night.